Hello everybody, Dr. Dave here. Welcome to Tipsy Vervet. The purpose of our podcast is to help people make sense of life and create meaning. Well, what we talk about is based on our own experiences with addiction and helping other people who are overcoming addiction. The principles that we share are universal, and we think they'll be helpful to anyone who aims to better understand themselves and who wants to cultivate a life that's worth living, regardless of what their past experiences might be.
I'm Pierre, and I've been involved in the addiction community for over a decade. This podcast is independent of any other work we do, and we're in no way affiliated with anyone else. We hope that the spirit that comes across in our conversations is one of compassion, and that you find it helpful.
Tipsy Vervet.
Hello, and welcome to the podcast. I'm here with my friend David. What are we going to talk about today?
Let's talk about some of the real symptoms of addiction. You know, when we talk about addiction, we all know the cravings and the withdrawals and those sorts of things, but there are experiences that we have which we might not necessarily even identify or associate with our addiction, but what they enable us to do is to determine a path forward by managing these particular symptoms so we can move into a life that's worth living without having to chemically alter our emotions. Yeah. So one of the concepts of addiction that's often spoken about is whether addiction is a disease or not. And if you Google that, you will find as many people ferociously arguing the point that it is a disease as there are people who ferociously argue the point that it's not a disease and we shouldn't characterize it as a disease. And quite frankly, I think the argument is unnecessary, but maybe a starting point to addressing that perhaps would be to define a disease. And we talk about three concepts, right? Disease, illness, and sickness. Disease, definition of disease is that part of the body's not working properly. And in fact, in philosophy of medicine, the definition of a disease would be what the pathologist would be able to demonstrate. In other words, it's what you can see and demonstrate that is associated with the disease. So for example, if somebody has a stroke, you can put them into an imaging machine and you can see damaged part of the brain and you can diagnose a stroke. One of the reasons why people say addiction is not a disease is because there's nothing that's pathognomic of addiction. And you can't put someone in a scanner, right, and say that they have addiction. The same goes for many psychological issues like depression and anxiety. You can't put someone in a scanner and say, okay, he suffers from anxiety. Although you can see changes in the brain. You can see changes in the structure of the brain in different people. If you scan them before and afterwards, you can see changes that are associated with a period of depression. But on the other hand, you can put someone who's in love in the scanner and you can see changes in their brain. And people who meditate, you can see changes in their brain. The point is you can't make the diagnosis by looking for those things. And so some people say, okay, it's not a disease because you can't see those things. The second term that we use is illness. And illness, we use these terms every day interchangeably, but strictly, the definition of illness is a person's experience of that disease, right? So it's the symptoms that are associated with that and the thought processes that go with it. So sometimes you can have somebody who's got something that we would characterize as a disease, for example, but it doesn't have symptoms. So for example, if you're HIV positive and you don't have AIDS, you strictly speaking have the disease and you're HIV positive, but you don't have any symptoms. In early cancer, you can demonstrate that the person's got cancer, so you can see the disease, but they won't necessarily have symptoms, right? And then there are other conditions where you can't demonstrate the pathology, but you have symptoms. For example, depression. You can't demonstrate something we can say, okay, yes, you can see this, you're depressed, but you experience the symptoms of depression, low mood, feelings of worthlessness, separateness from other people, those sorts of things. And then there's a third concept, and that's of sickness, and that's how the disease or the illness relates to society. So I would classify, for what it's worth, that addiction is all three of those things. There's clearly something going on in the brain, right? The brain's not working properly. The brain is hijacked by the substances that we're using. It alters while we're using it, alters our mood, it alters our behavior, it alters our coordination, the relationships we have with other people. But in between, we are completely obsessed with drinking and using. We think about it all of the time. Even when we're not drunk, we're thinking about our next drink and where I'll get my next drink from. So our entire life revolves around that addiction. We spend an enormous amount of time getting it, using it, recovering from it, and then obsessing over it, thinking about how we're going to get it. So it influences every aspect of our life. Now, clearly the brain is not working properly. And of course, we experience symptoms that we'll talk about in a minute. And of course, addiction has a profound impact on society as well. So it really impacts on all three of those terms that we've been talking about. So let's have a brief look at characterizing then addiction. If you have a look at a model for a disease process, what we can identify is that there are predisposing factors. So these are things that are true about me that increase the chance that I'm going to develop this disease. It doesn't mean that I will develop it, but because I have these factors, it increases that. And then there are risk factors which do the same thing, also increase my risk. But these are things which are not necessarily innate to me, but they're things that I maybe have some control over. So if you take cardiovascular disease, for example, having a heart attack, predisposing factors would be, up until the mid-50s, men are at higher risk than women. So it will be being a man. Your age, your genes are very important. If your dad has a heart attack before the age of 40, you're at much higher risk if you're a male than other people, which doesn't mean you will have a heart attack, of course, but what it means is that you're at a higher risk. So it means that you need to do something about the other things that increase your risk that you can do something about. So these would be risk factors, right? So risk factors for having a heart attack would be things like unhealthy nutrition, lack of physical activity, having high blood pressure, very importantly, being a smoker, being overweight, things like that, right? So you can do something about that. So if you can identify that you've got sort of the gammy genes that increase your risk, then you can make sure that you eat healthily, that you don't smoke, that you get some physical activity, right? So those are predisposing and risk factors. That would cause some sort of change in the structure or the function of part of the body, which is the definition of disease, right? And then that may or may not have symptoms. So again, if we go back to having a heart attack, what happens is with these predisposing factors, if I then go on to develop the cardiovascular disease that increases my risk of having a heart attack, what will happen is you've got blood vessels, right? The blood is flowing through the blood vessels and that goes to the heart. That's what the heart looks like. And what happens is you get a blockage in these blood vessels, and so the blood can't get through to the heart muscle, and what will happen is part of the heart muscle will die. And that causes symptoms, right? And the symptoms of an illness relate to the part of the body that's ill. This is a very, very important, seems like a simple concept, but it's very, very important, right? So if my heart is damaged, then the symptoms of that damaged heart will relate to the damaged heart. So the first thing will happen, I'll get chest pain because that's where the heart is, right? It's the heart that's painful. But the heart also won't be able to pump blood around my body properly. And so my blood pressure will drop and I won't be able to pump blood to my brain and I'll fall over, right? So the symptoms of the illness relate to the part of the body that's ill. Now, after we've made that diagnosis, right, there's some sort of management plan for an illness. And so if for taking a heart attack again, what are we going to do? Are we going to take you to theatre? We're going to unblock this artery. We're going to give you stuff to lower your blood pressure and manage your diabetes. I advise you to stop smoking, that sort of thing, right? So there's some sort of management plan. So let's talk about that framework in the context of addiction. So there are predisposing and risk factors for addiction and other conditions. Now, which part of the body is ill in addiction? Right, the brain, right? And the brain, what does the brain do? Thinks, it thinks, right? So the symptoms of an illness relate to the part of the body that's ill. And in addiction, the brain is ill and the brain thinks. And so when your brain is ill, your thoughts change. Very, very importantly, because one of the things is that we We relate our thoughts to ourselves. I am my thoughts, right? I am depressed. I am no good. I can't get on with anybody. And when we're having thoughts, we can't imagine having other thoughts. So those thoughts become our reality, and they influence how they influence our experience of the world and how we see ourselves and our place in the world. And this is one of the problems with any condition that affects the brain, is it affects your thoughts. And so, when people say, I've heard people say, if you don't want to stop drinking, you're not going to stop drinking. So you might have not tried. You have to want to do it, or you have to want to do it for yourself. And of course, it's an incredibly cruel thing to say to anybody, because most of us don't want to stop drinking because we have learned that this is how we cope with a difficult life. Life without alcohol is scary. And I can't imagine what that will be like without this coping mechanism. And so even if in the thinking part of my brain, I can see my life falling apart and I'm spending a lot of money and my relationships are in difficulty and I crashed the car again and I've injured myself or got legal problems, I want to stop. In my subconscious, in the parts of my brain that are involved in learning, I've learned this is how I cope with a difficult life. And so that part of the brain doesn't want to stop. And that's a much more powerful part of the brain than the thinking part of the brain. So I always say to people, if you feel like you don't want to stop, and very often, and we spoke about this last time, but your brain makes sense of those thoughts. I want to stop, I don't want to stop. And so it has to make sense of these two thoughts. I can't stop. So a lot of people feel like they can't stop. It's not because you can't stop, it's because you're a human being and that's how the brain works. And so we need to understand that, right? The brain is ill, your thoughts change, and you have these negative perceptions, you have these negative thoughts. But these are symptoms of the illness. It's similarly people who are depressed, right? I feel like I'm worthless. I feel like I can't do anything right. I've got a low mood. I can't imagine anything positive is going to happen. I'm just a burden on other people. And for me, this is my reality. But these are symptoms of depression. They are abnormal thoughts created by a depressed brain. And when the depression starts to lift, those thoughts will start to change to more helpful thoughts. So some of the predisposing and risk factors that we talk about with addiction, your genes are important, but they don't define your future. So genes may be present and we don't know whether they are or whether they aren't. And that's one of the problems with genes, right? So I don't know whether we should worry about genes too much, except that if you have addiction in your past, then it may be that your children are at higher risk of developing addiction themselves. Now, is it the fact that you've got addictive genes, or your addiction created a chaotic home environment that increases your children's risk? Clearly, we know that a chaotic home environment is very important for developing maladaptive coping skills later in life, including addiction. And it's important for people to understand that every drink you take, you drive your own children closer to alcoholism. And so many of us know this because we have a past where our home life was chaotic. And so one of the risk factors for addiction is past experiences. And we talk about adverse childhood experiences. The big three, of course, are physical abuse, sexual abuse, and emotional abuse. And of course, emotional or psychological abuse always goes hand in hand with the other two. And problem with psychological abuse, if it exists on its own, it's not as visible as the other two. So a lot of people suffer, children who are exposed to this suffer in silence. There are other adverse childhood experiences like divorce in the family, traumatic events, sickness in the family, death in the family. And some people these are very common, by the way. It's uncommon actually for a child to go through life without experiencing something.
Yeah.
And many, probably the majority, will grow up into healthy, functional adults. And so what is it that some people can go through these things and seem to emerge from them, and sometimes even become stronger through them, whereas other people develop maladaptive coping traits like turning to substances and alcohol. And it's because nothing happens in isolation, right? There's a life that's going on around you as well. So it's the context in which these happen that's really important. And even if, you don't have supportive parents, even if you've got one or two supportive adults in your life, you can grow up as a functional person. What happens is children who are not nurtured and are not given the emotional validation, who don't feel safe, they don't develop properly. As we grow up through our infancy, our early childhood, our later childhood, our adolescence, early adulthood, into adulthood, we learn executive function. Our brain develops, and this is part of wisdom, right? This is the thinking part of the brain, at the front of the brain. And executive function is, first of all, self-awareness. So this is a perception of myself, what I'm feeling like, what thoughts I'm having, what that little voice in my head is saying to me, and who those little voices are, right? Because you're not the only person who lives in your head. There are lots and lots of people in there. And sometimes there are so many people in there, it's very difficult actually to find your own voice amongst all of that chatter. And so a lot of what we think and what we do is actually other voices telling us. And those are our parents, our friends, other influential people, things we've watched, movies we've seen, things we've heard going on in our head all of the time. So we need some sort of sense of self-awareness that we can emerge through that. Filter through that, yeah. How I'm behaving, how I'm coming across to other people, how loudly I'm speaking, what I'm feeling. One of the very important elements of self-awareness is to identify the emotions that are behind the feelings that I'm feeling. And if you grow up as a child and your emotions aren't validated, you won't be able to identify what you're feeling, and everything starts to feel the same. In fact, I think one of the reasons why people turn to addiction is because feelings are too uncomfortable for them, actually. And we'll talk about that a bit later on. But I mean, if you tell a boy that men don't cry, when he grows up and he feels sadness or anxiety, he will experience anger. And that can often translate then and come across as aggression. If you tell a girl that she's not important and she doesn't need to, she's only a girl, so she can be barefoot in the kitchen and it doesn't happen. When she grows up and she feels anticipation and motivation, she'll experience shame. And so what happens is a lot of time we have trouble identifying the emotions that we're experiencing. And this is one of the problems why people actually have trouble also with emotional regulation. So there are no good or bad emotions. It's what you do with them that makes them helpful or unhelpful. If you can't identify what those emotions are, and we don't actually experience emotions, right? What we do is we experience the feeling associated with the emotion. So our brain creates the emotion to tell us what our body needs. We experience the feeling associated with that emotion, which is thoughts and bodily sensations, right? So if I go into a place where it's unfamiliar to me, my brain will create the emotion of anxiety, and I will experience that as a feeling on thoughts like, be careful, this is new, watch out. And I'll get sensations, this sort of like nervous feelings, right? Your heart might beat a bit faster, might start breathing a bit more. So that's what I experience. And one of the problems is if you don't grow up healthily where your emotions are validated and you're taught to identify them and that all emotions are okay, then you have trouble identifying those emotions and you later have trouble regulating your behavior associated with emotions. So it's okay to feel angry in the traffic, and a healthy person would notice that and accept it for what it is. Somebody who can't regulate their emotions would start screaming and shouting, and it's okay to feel angry. It's not okay to take a brick out of the boot of your car and hit someone in the head with it. So that's emotional regulation. Self-regulation is very important. Self-regulation is the ability to control your behavior to achieve an optimal goal. And clearly in addiction, we don't have self-regulation, right? We think a bit of work, it's 9 o'clock in the morning. A drink would be nice right now, but I've got to pick this up 2 o'clock. I can't have a drink, but just one will be okay, so I have one. And of course, what does alcohol do? The first thing it does is causes a case of the fuck-its, right? Takes away all anticipation of future consequences. So I only have to have one drink, and that's 2 bottles later. It's by 9:30, I've already had 2 bottles. To be motivated, if you grow up in a home that's chaotic and things are not fun, you don't learn to be motivated. And to persevere once you start, right? So you to not give up once, if you're feeling despondent or things are not going your way or you get bored. So these are very important to be able to solve problems and to imagine outcomes. This is very important. Executive function is to be able to play things forward such that we don't need to experience something to imagine what the outcome may be. And of course, that's very important because it protects us from doing stupid things and hurting ourselves. Except that in addiction, I know that it's going to turn out badly, but I do it anyway, So again, our foresight and our hindsight. So thinking back yesterday, I crashed the car, everyone was cross with me. I don't feel so well this morning. It'll probably turn out that way, but maybe not. So I'll have another drink. So our foresight and our hindsight, our predictive ability, not necessarily our predictive ability, but our regulation based on foresight and hindsight is not normal. So you can see in addiction, all of these things are underdeveloped. And so if we're going to embark on a journey of learning to live a life that's worth living, we need to identify some of the things and put things in process, which we'll talk about another time, to cultivate these things, to cultivate self-awareness, to cultivate emotional regulation, to cultivate self-regulation, to cultivate a life in which we're motivated to do things, or even in the face of not being motivated to do things, to regulate our behavior so we do them anyway, right? So we'll talk about this in a sec, because that's one of the most important ways forward. So, of course, if you grow up with any of these things, and even if you don't, you can develop other mental disorders which increase the risk of turning to substances to cope. Depression and anxiety, of course, are big ones. All of us, if you have a look at this, all of us who turn to substances have one thing in common, and that's poor coping skills, which is these executive functions. Other things that are important, sometimes if we've had traumatic events, or we might suffer from post-traumatic stress. When I talk about that, what I mean is we may have intrusive thoughts that relate to the scary event that happened to us. We may have dreams about it, and our memories don't change. And so what happens is when we think back to these things, we re-feel what we felt at the time. Now, it may not be severe enough to classify it as a disorder, perhaps, when we talk about post-traumatic stress disorder, like people in the military get. But it can be quite distressing for us. So other things that increase the chance we might turn to substances to help us cope is poor relationships. Some of us feel very strongly that we don't fit in, and we feel separate from other people. Now, we've spoken about this before, but this is a common element of human psyche, is that we feel different from other people. The one thing we all have in common is that we all think we're different, right? And there are reasons for that. But for some people, they have a lot more trouble, and they feel very isolated. So they have these feelings of isolation, and these are uncomfortable, of course. If you learn or you don't learn that things are worthwhile doing, and you don't learn to be motivated, you can suffer from low motivation and an inability to imagine that something's going to be fun. So we call this anhedonia, right? Very, very common. Something that lots of us experience. is that we've had a difficult past and we can't imagine feeling pleasure from doing things. And as a consequence, we don't feel motivated to do things. So anhedonia means an is absence of, right? And hedonism, pleasure, drug, sex, and rock and roll, right? Anhedonia, absence of pleasure. For many of us, actually, if you've got a major depressive disorder, for example, which most of us don't have, everyone suffers from depression, everyone suffers from anxiety. It's just that some of us cope with it less well and maybe experience more of it or it's in a deeper state than other people. But that doesn't mean that we have a major psychiatric disorder. It's very important to recognize that. But many of us experience anhedonia. We don't have major depressive. In major depressive disorder, the anhedonia means you cannot experience pleasure. But in fact, for many of us, that's not actually what we experience. What we're experiencing is a low anticipation of pleasure. We don't imagine that we're going to experience pleasure. And the difference is that, and I call that apathy, right? As opposed to anhedonia. Maybe it's a very mild form of anhedonia. But I don't imagine that I'm going to experience pleasure, and so it stops me from doing things. Whereas if I do things, then actually I often notice that I'm getting engaged in that and I am actually enjoying it. And so then what happens? We get some sort of change in the structure and function of the brain. And we start using substances. So we use. Now people say to me, is addiction a choice? And I want to be very clear, in active addiction, it's clearly not a choice. There are changes that happen in the brain that lock you into addiction. That's why you need to experience sobriety to embark on, you need to experience abstinence to embark on a journey of healing, because active addiction is very, very difficult to break. So, but clearly there's some sort of choice to start using it in the first place and to repeat that behavior, right? Problem is when you use it the first time and it starts to relieve some of these symptoms that I'm experiencing, then very quickly my brain learns that this is how I cope with a difficult life. And so I repeat it and it becomes almost locked in. And that learning is extremely powerful. And that sets up changes in the brain that sort of lock me into this years of drinking, using drugs. Now, there are symptoms that come from this behavior. So let's have a look at what some of these, there are the big three symptoms. The big three symptoms to me are a sense of hopelessness. And many of us feel completely hopeless while we're in the throes of active drinking, active addiction. Anhedonia, all drugs cause anhedonia. They hijack the normal parts of the brain involved in motivation, and they take away all desire to do the things that used to bring you pleasure or would normally bring somebody pleasure, because nothing will enable you to feel that relief and release that comes with using drugs and drinking alcohol. And alcohol is, of course, just a drug. So I don't get pleasure from other things anymore. And of course, I become very apathetic about things. I don't want to do anything else. I spend a lot of time obsessing over my drinking and thinking about that and the release it's going to give me. Third, a big symptom is this sense of isolation. And this sense of isolation, it's not loneliness, right? It's a malignant sense of aloneness. There's nobody else in my world. No one else has done these things. No one else has thought these thoughts that I'm thinking. And all drugs cause depression. You know, even when you're on meth, you know, you're up for 7 days and but you eventually come down, right? All drugs cause depression. All cause anxiety. Particularly alcohol causes all of these things, right? And the problem is this is a self-fulfilling prophecy because I feel depressed, so I drink and alcohol. And initially, maybe the first couple of sips lifts me up a bit, but then it causes depression. And it just keeps this vicious cycle going. Anxiety. I remember just driving out of the gate with this incredible sense of impending doom, that something terrible is about to happen. The world is caving in on me, and you can't put your finger on it, you have no idea what that's about. This terrible, terrible sense of dread. Of course, poor relationships. And very importantly, of course, poor coping skills. Can't cope without the drug, but while I'm using the drug, I can't cope either, right? And then we talk about some of the other things that we often don't identify, but we call them corrosive fallout, right? So these are things that go along with using, which are not directly related to my physiology, but things like I'm spending too much money, so I get into debt, I get into legal issues, maybe I have housing problems, my relationships are completely falling apart, and I have conflict, maybe I lose my job. So there are all these other sorts of things that go with addiction, which need to be addressed. I want to point something out here, that all of these cause me to use, right? Cause me to drink. And yet all of them are symptoms of my drinking. So you see what's happening here? It's the things that are driving me to drink that come out of my drinking. So it's a vicious cycle. So the first thing, if you're going to recover from drinking or using other drugs, is you have to stop, right? This may be self-evident, but it misses. A lot of people pass this by. You have to stop. If you don't stop, your depression and anxiety will never get better. Any medication that you take cannot work. How can it when your brain chemicals are going like this all the time? Your psychotherapy cannot work. You have to stop. I just want to go down here, and what are we going to do about some of these things then? So hopelessness is my life is difficult. There's nothing I can do about it. But that's not why people are listening to us today, right? My life is difficult and I don't know what to do about it. Big difference, right? Hopelessness, I'm driving along in a boat. I fall out the boat and the boat drives off and leaves me floating. That's hopeless, right? But that's not where we find ourselves. My life is difficult and I don't know what to do. There's a lovely sense of wholeness when you realize that you don't know. Because as soon as I realize that I don't know, I don't even have to know what I don't know, right? Just the acknowledgement that I don't know what to do puts me in a position where I can ask for help. So things are not so hopeless as they seem. The sense of isolation, very, very importantly, if we're going to recover, we're going to move into a life that's worth living, we need to surround ourselves with community. Now, for some of us, it's quite difficult because maybe we've been hurt by other people, maybe we feel self-conscious, maybe we have a bit of social phobia, but we need to surround ourselves with community, and there are different ways that we can do that, right? And to start with, everyone can find a community of other people who've experienced similar things to them. And we'll talk about that, the power of the group. So community is extremely important. When you stop using, some of your relationships will already start to improve. But what we have to do also is we have to identify which relationships are healthy and which relationships are unhealthy. You need to be very careful, right? Because you might be the unhealthy one in the relationship. But we need to start stripping away the relationships that are not helpful to us and cultivate the relationships that are meaningful and that are. Depression and anxiety, when you stop using, you will automatically notice that your depression and anxiety starts to improve. Now, for some of us, especially if you have depression and anxiety before you start, some of those symptoms will remain. And so it may be that we need additional help for those. So in the medical profession and the psychological profession, perhaps. Much of overcoming these conditions, though, is learning how to manage the symptoms of them. As you know, treatment for depression, antidepressants won't take away your depression if you've got depression. They take a bit of the edge off some of the symptoms, perhaps for some people. For many people, they actually don't really do very much at all. And so one of the things we're going to move forward to do is to learn to live with some of these residual symptoms. And there are lots of things that we can do to help to manage those. And so we'll talk about that when we talk about finding meaning right? Which is very, very important. So what do we do about the anhedonia and the apathy? Because this is very common, and it's one of the symptoms that may have been there before we went into addiction, but it's also one of the symptoms that may remain afterwards. And it seems like nothing's worthwhile. I don't look forward to anything. I don't want to do anything, and it reduces my motivation and my ability to persevere. And the answer sounds very simple, but it's absolutely spot on, and that is to just do stuff anyway. Just do it. I have this philosophy I call carry on despite. It doesn't matter how you feel. Do it anyway. And when you do that, you'll often find that you get lost in something, and all of a sudden you'll realize, hey, I am enjoying this. But there are other reasons to do things. And it sounds very simple, and a lot of people have trouble. If you want to do something, then again, surround yourself with community. It's much easier to be motivated to do things when somebody else is motivating you. If you want to go to support meetings, then have somebody pick you up or pick somebody up. Joining a group holds you accountable to the group. If you want to start doing physical activity in the morning, for example, then do it with somebody else, I used to cycle every morning at 5 o'clock with my neighbor, and every morning we'd get up and say, hey, I didn't feel like going this morning, but I had to get up because you were waiting for me, So doing things is very important. We talk about this a lot, you and I, but there are 3 elements to doing something. There's the anticipation and the planning. A lot of us don't really like that. And also, if you don't really want to do something, then you're not really looking forward to it. Then there's the doing of it. That may or may not be enjoyable. Most importantly is the 3rd element of doing something is what comes next. Nothing comes from nothing. If you do nothing, nothing will come from that. But if you do something, there is always some sort of outcome of that. Maybe you hate playing cricket. Someone says, hey, come play cricket. And you don't want to do it, but you say, okay, yes, I'll go play cricket. And you meet someone there who does motor racing. And they say, hey, come to the track next week. And we go to the track and you find you love motor racing. The other thing is you don't know who you're going to be in 10 years' time. You can be doing something now, and in 10 years' time, you're a completely different person. And you look back on that with pride that I did that, even in the face of not wanting to. So the treatment for anhedonia, amongst other things, is to do stuff and do lots of stuff, do lots of varied things, and do things that are fun, and do things that are worth doing just for doing it. And so these are some of the elements that we're going to refer to again when we talk about moving forward into a life that's worth living. And they're based in 3 elements of philosophy. The examined life, developing a sense of self-awareness, right? What am I thinking? What am I feeling? Community, developing a supportive community around ourselves. And virtue is learning how to behave, learning how to regulate my behavior so that the outcomes for me are the very best they can be under those circumstances at that time. And one of those elements of doing that, which is very important, is to do things. Now,
yeah. That was, I love the way that you put that. I'm a big believer in the just do it. We've seen the results over the years with the people that we've worked with along the way. What has been your experience with applying the things you've spoken about now when you were feeling the way that you described a bit earlier?
Very important. The first thing was that I was introduced to community because I was very, very isolated. And the man who became my mentor, actually, in one of the social groups that we're very involved with, he duped me into going to a meeting I would never have gone if he hadn't picked me up and told me we were going. I can't remember where he told me we were going. But he said, I want to take you somewhere on Saturday morning. And I'd been going to various support groups and I didn't like it at all. And the other thing is I hadn't been able to stay abstinent. So I just felt like a complete failure. And I felt very isolated from the people in those groups who seemed to be apparently doing better than me. But he took me to this meeting, and it was a very large meeting. There were about 150 people at this meeting. And they were talking about what it's like to be an alcoholic. And I looked up and I realized for the first time I was in a room full of people who were learning to live differently, And that moment was found for me because I realized that if they could learn to do it, I could learn to do it too. And I wasn't a failure for not being able to stay abstinent up until now, because you can't fail at something you don't know how to do, right? You're going to mow the lawn, someone's got to teach you how to turn the lawnmower on, yeah? But the third thing I realized, and I was very lucky to have the support of this wonderful man, was that I would need someone to teach me, and I would need to embark on this journey of learning, right? And what were they learning to do? They were learning to live a life that's worth living. They were learning all of these elements that make life meaningful. They were essentially learning executive function. They were learning how to be more self-aware. They were learning how to identify their emotions, right? We call this alexithymia, right? This is the term for it. Alexithymia is an inability to identify the emotions that I'm experiencing. And so you sort of like flat a lot of the time. In fact, I think that's why, when we look at people who drink, I think we sort of operate on this level of emotion, if you're looking at over time. And anything that takes us out of this sort of like level of feeling flattish. So these would be emotions that don't feel so good, so like anger, sadness, anxiety. That's uncomfortable because it takes us out of here. But equally so, emotions that do feel good, like happiness, excitement. For me, one of the biggest triggers to activate craving to drink is the feeling of relief. And I think that any emotion that takes us out of this sort of flat state is uncomfortable. And so it's what a lot of people say to me, I'm okay when I'm miserable. And I think because maybe when they're miserable, they're more on their guard, more vigilant. It's when I'm happy that I relapse, because it takes me out of my vigilant state. But it also, it's more uncomfortable. So one of the things that we're learning to do is we're learning to identify these emotions. We're learning to identify the feelings that we're feeling and what some of the emotions are behind them, and make sense of those emotions in the context of what's happening now. So, for example, a lot of us feel anxiety, and it's completely incongruent with what's going on around us. There's no reason for us to feel anxious, and it's intensely uncomfortable. And the starting point for that is to notice that I'm feeling anxious and that there's nothing I specifically need to feel anxious about, which doesn't mean that I shouldn't feel anxious, because I didn't choose to feel anxious. But in that is just the recognition that I'm feeling anxious now. It's not nice, but it's okay. It'll pass. Whereas before, it was so uncomfortable that I had to drink to dampen it down. And the other thing about this community was that they had each other. There was always somebody to phone if they needed help. The one thing I always say to people is that when you join these groups, and different people have different experiences, and we'll talk about the group specifically on another occasion, but you never have to do anything alone again. And, one of the ways that we're going to move forward, and it's inevitable that this will happen, is that we will experience hardships. Just how life works, right? That's how you grow as a person. That's actually what makes life meaningful, is overcoming these hardships. And the more hardships I overcome, the more hardships I realize I can overcome. And so I develop this sense of equanimity, of sereneness. I'm not worried about things anymore, because I know that whatever happens, I can handle whatever comes my way. And I know that because I've handled things in the past. And so equanimity, this feeling that things will be okay because I can handle them, it must be learned. But to learn it, you have to face hardships. And it's much easier to face hardships if you don't have to face them alone, right? And this is one of the problems with drinking and addiction, is that I was so isolated from other people. And even the people I know who did drink with other people, they drank with those people. That's what they did with it. So it wasn't that there was a sense of strong support per se, right? Because they're just drinking buddies, really. So, yeah, that was the starting point. Yeah. And many of these symptoms remain. I just wanted to point some out because people talk about this, especially some of the medical professionals, they talk about that there's sort of the assumption that everyone who goes into addiction, or many people who go into addiction, have some sort of mental illness prior to that. And that may be true for some people. Mental illnesses are a big risk factor for becoming an addict. So a lot of people cope with their depression or their post-traumatic stress disorder or their anxiety, or people who are more psychiatrically ill, bipolar disorder, or even schizophrenia and things like that. They use alcohol to self-medicate. And so there may be an element of psychological disorder behind the addiction, which in itself also requires treatment. In my experience, though, because drinking and using drugs is very common, although many of us have elements of those, we do not have a mental illness. And so we have elements of those. And for many of us, we do experience quite severe depression and quite severe anxiety. But we need to manage that by improving our executive function and our coping skills. It doesn't mean that those symptoms will go away necessarily, although for many people they improve significantly. What it means is that we learn to live a life in which we can manage with them, right? So what I'm suggesting is, and we'll talk about this in detail, medication will not take away your addiction. What will help you to stay abstinent is to learn what we should have learned as young people, and to move forward into a life that's worth living, where it is worthwhile despite the residual symptoms of depression and anxiety, and despite life still being hard, because life is hard. We don't have to drink to chemically alter our emotions. That's the treatment for addiction. So there's a smaller group of people who have these pre-existing conditions, and they require specific therapies. But for most of us, we don't.
Hurts. Well, that's a lovely place to close off. I know that the next session I'm really looking forward to as well. Thank you very much for tuning into the podcast. As usual, we'll leave some information down below in the bio. And thanks very much for your input.
Well, thank you.
Until next time.